There were similar protests today all across the country, but here in Raleigh, healthcare workers on the front line of the fight against COVID-19 faced off with protesters today. Colleen Quigley is live tonight with more on what they say needs to happen before the stay-at-home order is lifted. Colleen.
Angela, I spoke with the group that represents the largest group of healthcare workers in our state, and that is our nurses. They tell me tonight they understand people are going through a tough time financially right now, but their message is clear. They want us to stick to the plan and stay home because they're afraid if we open too much too soon, we could risk a spike in cases.
They are no longer law enforcement officers. They are tyrants.
As hundreds of people marched in downtown Raleigh demanding Governor Cooper end the state's stay-at-home order.
I'm worried that if we reopen NC that we'll see another spike.
Healthcare workers stood outside the Capitol with a message of their own, reopening responsibly.
Opening up too much too soon could be counterproductive and actually make things more difficult for us.
Tina Gordon is the CEO of the North Carolina Nurses Association. They represent the state's 140,000 RNs. She supports a staged reduction in social distancing once the state achieves 3 goals: a drop in cases over a 2-week period, reliable access to testing and PPE, and contact tracing.
There are nurses that don't have what they need to safely take care of patients, so that's a problem. And we don't want to do anything that risks an escalation in the number of cases until we have a firm control on safety and testing and trends.
Gordon says if the state reopens before these goals are met, it could cause a spike in cases down the road.
The virus hasn't gone away. We don't have treatments that will make it go away. We don't have vaccines that will make it go away. So we have to find ways to control it.
Gordon understands business owners and furloughed workers' frustrations, but says everyone needs to be patient.
We're all on the same team right now.
Well, what these nurses want to see happen is actually pretty in line with President Trump's guideline for rolling back some of the social distancing practices. And that also includes those effective testing and tracing measures, as well as a 2-week period of decline before we can begin to roll back some of those practices. Reporting live in Raleigh, Colleen Quigley, CBS 17 News.